The MV Hondius Hantavirus cluster just moved for the first time in 2 weeks. A Spanish passenger in a Madrid military hospital is now confirmed, bringing the total to 11 cases, 9 confirmed, per CIDRAP.
11 now. And that case came from quarantine. Exactly the thing this cluster's been stress testing.
This is Hantavirus Watch. Today, the new Spanish confirmation, the tighter RIVM monitoring protocol in the Netherlands, and how ECDC's May 20 classification lines up with the updated count.
And I've got one question Spain still hasn't answered out loud. We'll get there.
Let's be precise on the number, because 11 by itself doesn't give the whole picture. CIDRAP has 9 confirmed, 11 total, so 2 of those are still suspected, not laboratory confirmed.
And that split matters, because back on June 7, Virginia's health department hedged, said more cases were possible. That hedge aged better than the people calling this stable.
The Spanish case fits cleanly with ECDC's May 20 assessment, Hondius Hantavirus, ship-linked. The strain identity hasn't changed. The count has.
Okay, here's the thing I can't let go of. There's a confirmed Andes patient in a Spanish military hospital right now. Spain received a compassionate use favipiravir shipment. Did that pathway activate, or is the drug sitting on a shelf?
No public document in today's rundown answers that. The CDC Han, dated May 19th, is aimed at clinicians, but it doesn't name a treatment.
Right. So if a former Hondius passenger walks into a clinic in any of the 9 contact tracing countries with a fever today, there's still no published line telling that clinician what to reach for. A week of asking, and the page is still blank.
I'll keep the treatment silence separate from the surveillance piece, because surveillance is working. The RIVM update from June 3 is the example. 1 person in home quarantine in the Netherlands is now being tested twice a week instead of once.
See, that matters to me. Twice weekly testing is a clinical escalation. And RIVM isn't saying what triggered it. A symptom? A borderline result? Precaution.
The boundary matters here. This is still an existing contact under tighter monitoring, without a new case or a new transmission event.
But it's the same Dutch system that hospitalized a confirmed patient last week, and it's visibly adjusting, which makes the silence around favipiravir feel fresher, not staler.
The clean read today is simple. The monitoring held for 2 quiet weeks, and then it caught something. The system did what it was built to do.
Fine, the catching works. I just want one agency to say, on paper, whether the treatment pathway ever worked. 11 cases in, and that line still hasn't been written.
Here's Stephanie Suchere at CIDRAP.
A Spanish passenger on the MV Hondius cruise ship who is in quarantine at a military hospital in Madrid is now confirmed to have hantavirus, raising the outbreak total to 11 cases, 9 of which have been lab confirmed. The death toll remains at 3.
The count moved. CIDRAP confirms the Spanish passenger in the Madrid military hospital. That takes us to 11 total, 9 lab confirmed. Death toll holds at 3. And I want to be precise on that split. 9 of 11 are confirmed. The other 2 are still suspected. Hondius Hantavirus, ship-linked. That's the classification ECDC put on paper.
So here's where I sit up. A confirmed Andes patient is in a Spanish military hospital, and Spain got compassionate use favipiravir. I've asked this 3 days in a row. Did the pathway activate, or is the drug on a shelf? And nobody's published a word about it. The number moves, the patient is identified, and the one sentence I want, what they reached for, still isn't anywhere.
Tedros said in Madrid there's no sign of a larger outbreak, but he flagged that more cases are likely in coming weeks. That points to the incubation window more than escalation. Andes can incubate for up to 42 days before symptoms.
Right, which means Virginia's more cases possible hedge from June 7 is aging a lot better than anybody's stable cluster line. The count just proved the hedge right.
This one comes via the European Center for Disease Prevention and Control. The key document here is the ECDC notice dated May 20, the one that classifies this cluster, Hondius Hantavirus, ship-linked. That's the strain identity on the official record. That matters today because the count just moved. The CIDRAP piece we just hit puts it at 11 cases, 9 confirmed. The ECDC text tells you what those 9 are confirmed as. Andes, not sin nombre, not sol.
Right, but that notice is from May 20. The count's at 11 now. So the classification's solid. The document's just 19 days behind the actual case numbers.
That's how a rapid risk assessment works, Brian. It freezes the strain and source picture at a point in time. The classification holds even as the count climbs. Andes is still Andes.
Fine, but pair that May 20 ECDC notice with the Virginia Health Department hedge from June 7. They said more cases were possible. The Spanish confirmation says they were right, and stable was the wrong word.
Centers for Disease Control and Prevention writes,
On May 2, 2026, an outbreak of Hondius virus on a cruise ship was reported to the World Health Organization, WHO. This outbreak has raised the possibility of cases being imported to the United States. As of May 18, no confirmed cases of Hondius virus associated with the outbreak on the cruise ship have been reported in the United States.
This is CDC's Health Alert Network update, CDSHAN 00529, dated May 19. It's the follow-up to their May 8th advisory, and what it adds is testing guidance, what to run on a patient with suspected hantavirus, Hondius virus included. And the document is clear. Hondius is the one New World hantavirus that spreads person to person. The others, the ones endemic to the U.S., don't. As of May 18, 0 confirmed Hondius cases stateside. U.S. public risk, extremely low.
Right, so this is addressed to clinicians in state health departments. Sarah, if a former Hondius passenger walks into a clinic in one of the 9 contact tracing countries today with a fever, does this document tell that doctor what drug to reach for? So we've got the CDC's Han advisory and update, plus ECDC's May 20 notice, 3 official records in the stack, and not one of them says out loud what happens after the test comes back positive. I'm going to let that sit.
Brian, just to be precise, diagnosis is exactly the piece that moved the count we opened with, 9 confirmed of 11. This document is part of how that 9th number gets made. Here's RIVM.
Following this signal, several additional tests were conducted on this person. These results are all clearly negative. The person also has no symptoms of illness. Multiple negative test results and the absence of illness symptoms are not consistent with an active Hondius virus infection. Therefore, this person is not contagious, and the Dutch National Institute for Public Health and the Environment, RIVM, does not count this person as a patient.
RIVM's June 3 update isn't a new case. It's a monitoring decision. One person in home quarantine goes from weekly testing to twice a week, and they're now sampling multiple bodily materials. The trigger was a single week positive signal. Every follow-up test came back clearly negative. The person has no symptoms. So RIVM is explicit. They do not count this person as a patient. That keeps us at 9 confirmed, 11 total per the CIDRAP brief we hit earlier.
Hold on. What flips someone from once a week to twice a week? RIVM actually answers it here. A week positive that then read clean on repeat. That's a clinical call, and they told us what drove it. And the part I keep circling, a week ago I wanted to know if the Dutch system would tell us when it adjusts. It just did. So when a confirmed Hondius patient is sitting in a Madrid military hospital, why has nobody published whether Spain's favipiravir stock actually got used?
This one's from CNN.
18 people bound for the U.S. were among the dozens of passengers who disembarked the cruise ship at the center of a hantavirus outbreak on Sunday. The ship docked in Tenerife, Canary Islands for a carefully managed operation evacuating passengers and escorting them to flights arranged by multiple nations. More evacuations will take place Monday.
This is the disembarkation itself. Tenerife, the MV Hondius, 18 U.S.-bound passengers among dozens off the ship. The CIDRAP count we covered earlier flows from this. a carefully staged evacuation that fed contacts into surveillance in 9 countries.
And look at the photo. Evacuees stopping at the top of the air stairs to take selfies before the flight home. Strict safety protocols, and the first instinct is a group selfie.
The selfie is harmless. The important part is the setup. Flights arranged by multiple nations, people escorted out, then routed straight into quarantine and tracing. Weeks later, that same system just caught the Spanish case in Madrid.
Right. 18 people headed to the U.S. The Nebraska cohort cleared their window. But this dock is where every one of those contact trails across 9 countries actually starts. Every itinerary listeners are asking about traces back to this gangway.
If you appreciate this kind of close, daily tracking, try Arcadia Mayor Spy Watch, a court watch on the federal foreign agent case involving former Arcadia Mayor Eileen Wong and the related resolved case against Yaoning Mike Sun. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. If one caught your attention, they're there when you want to dig a little deeper. That's Hantavirus Watch for today. This is a Lantern podcast.